Breast cancer is one of the most prevalent health conditions affecting millions of people each year. With an aim to treat and spread awareness about breast diseases, Dr. Swati Suradkar, a distinguished consultant breast surgeon, will be sharing her expertise and insights on breast cancer. Let's learn more from her with me, your host Anam Sheikh. Swati Arun Suradkar is a renowned consultant breast surgeon in Pune with over 10 years of experience. She graduated from BJ Medical College in Pune in 1999 and completed her post-graduation in general surgery from Ruby Hall Clinic. Dr. Suradkar received specialized training in breast cancer surgery from Tata Memorial Cancer Center in Mumbai and pursued advanced training in Oncoplastic Breast Cancer Surgery at Guy's and St. Thomas Hospital in London. She is a member of several medical associations including ABSI, ASI, IMA and Pune Surgical Society. Dr. Suradkar's expertise lies in breast conservation surgery, oncoplastic breast surgery and aesthetic breast surgeries. She is dedicated to not only treating breast cancer but also raising awareness about early detection and prevention. She has organized breast checkup camps, diagnostic camps and seminars and has been a guest speaker on breast cancer awareness platforms. Dr. Suradkar's patient-centric approach and surgical skills have benefited numerous patients, bringing hope and smiles to breast cancer survivors and their families.
I'm Anam Sheikh from Pune Times Mirror and we are in conversation with consultant breast surgeon Dr. Swati Suradkar. Hello ma'am.
Hello Anam. Nice to meet you.
Nice to meet you ma'am. So as we start ma'am, please explain the incidence of breast cancer.
25 to 27% of all the cancers happening in women are breast cancer. It is the most common cancer in the women, and the incidence of breast cancer is rapidly rising all over the world and also in our India. So 40 to 50 is the age group where breast cancer is more prevalent in our population. We are coming across many young women who are coming positive for breast cancer. People should be very much aware about it as the rapid rise in the cases of breast cancer is happening.
Okay. How common is it in women below 40?
Coming across many patients who are less than 40 years of age. We need to understand is that the breast cancer occurring in young women is more kind of aggressive kind of cancer compared to the older women. See, there are mainly three types of breast cancers.
Okay.
One is hormone receptor positive, second is triple negative, and third is HER2 receptor positive. So these three main types of breast cancer, these are three main subtypes, amongst which ER/PR positive, that is hormone receptor positive cancer, is the slow growing cancer. It is less aggressive and it usually occurs in older age group of patients. But the more aggressive subtypes, that is triple negative and HER2 positive, they are more prevalent in younger population, especially less than 40 years of age. See, there are four stages of breast cancer. Stage 1 and 2 are called early breast cancer. Stage 3 is called locally advanced breast cancer, and stage 4 is metastatic breast cancer. So the early breast cancer is which has got a more good prognosis and good survival, and the advanced breast cancer has got not as much good prognosis or survival. And younger women are coming across with more advanced stages of breast cancer. So that is the difference between young and older age group.
What are some of the most common symptoms about breast cancer?
The most common symptom of breast cancer is having a lump in the breast.
Okay.
But 90% of lumps in the breast are not cancerous.
Okay.
But you need to be assured that you need to check it before declaring it as it is not a cancer. So you need to do test and prove that it is not a cancer. Usually women, they neglect the lump. They think that it is like there is no harm in this lump, there is no pain, there is no any other complaints. So they neglect, and when they come to the doctor, the lump is in a big size and more advanced stage. Other symptoms of breast cancer are like nipple discharge. So this nipple discharge can be blood-stained nipple discharge or brownish nipple discharge or serous nipple discharge. Other symptoms are, there are some changes over the breast, the skin over the breast or nipple. The nipple can be retracted, it can be pulled inside, there can be deviation of the nipple. The overlying skin over the breast may be, it may show redness or edema. There can be an orange peel-like appearance of the skin. The breast can be deviated. It can be pulled. The skin over the breast can be pulled in or puckered. Or sometimes there can be lumps in the armpit.
Okay.
And sometimes there are ulcers in advanced stages. In neglected stages, there are ulcers over the skin or on the breast. Then bleeding through the ulcers, satellite nodules. These are the local symptoms of breast cancer. If the patient neglects these symptoms and doesn't show the doctor, doesn't start the treatment, then there are advanced symptoms of breast cancer when breast cancer spreads to other organs of the body. If it most commonly breast cancer spreads to four organs of the body, like bones. If it spreads to the bone, then there can be bone pain or fractures. If it spreads to the lungs, then there can be a chronic cough, a long duration cough, or blood through the cough. If it spreads to the liver, then there can be jaundice or abdominal distension. If it spreads to the brain, then there can be a headache, seizures or coma, brain-related symptoms, and there can be generalized loss of weight, loss of appetite. These are few common symptoms of the. If they neglect this local early symptom, then it spreads to all other parts of the body, and then it becomes difficult to treat also.
Also, ma'am, what are the tests required to check if you have breast cancer?
Yeah, it is called for the diagnosis of breast cancer. It is called a triple test.
Okay.
So everybody should know what is triple test. Triple test include first is the clinical examination, second is the mammography, and third is the biopsy.
Okay. Is breast removal necessary for all types of cancer?
No. Breast removal is, nowadays the surgery is so advanced that breast removal is not necessary for all the types of cancers. Usually surgery is done upfront for early stage breast cancer, like stage 1 and stage 2 breast cancer. Breast conservation surgery, which is called BCS, can be done in many patients. Almost 80-90% of patients we do breast conservation surgery. In breast conservation surgery, we remove only the lump with some surrounding tissue, and that is called wide local excision. And we also send the lymph nodes in the armpit for histopathological testing, which is called sentinel node biopsy. So BCS with SNB, sentinel node biopsy, is the standard treatment for early stage breast cancer. If patient comes in advanced stage, in locally advanced breast cancer, then we have to give a chemotherapy to downstage the tumor size. And when the tumor is reduced with the help of chemotherapy, then we operate the patient and then we do the surgery. Radiation therapy is must treatment for BCS. The patients whom we don't remove the breast, we do breast conservation surgery, they have to take a radiation therapy. Chemotherapy depends on the tumor biology and whatever the final histopath report comes. In very small breast cancers, like if the tumor is very small, less than 2 centimeters, it is hormone receptor positive, tumor biology is favorable. In those patients, we can skip the chemotherapy.
What are the factors that can cause or affect breast cancer?
So as such, there is not a particular cause which we can pinpoint that because of this reason patient has got this breast cancer. But there are few risk factors which because of which one lady is prone to get a breast cancer. So first is the gender only, like breast cancer is most prevalent in women. 99% it occurs in women only. However, rarely in 1% men also can get a breast cancer. The incidence is very low, only 1%, but men also can get breast cancer. If the breast cancer happens in men, then it is usually more advanced stage. Then second thing is that the age. The incidence of breast cancer rapidly starts rising after the age of 40 years. Then Other hormonal factors are also important. So estrogen plays an important key role in development of breast cancer. So early menarche and late menopause. The women with late first pregnancy. So women having her first child after the age of 35 years. Then women who don't have children, which are called nulliparous women. Women who are not having any child. Then women who don't breastfeed their children. So pregnancy and breastfeeding are considered as a beneficial or preventive factors for developing breast cancer. Fatty women, obese women, sedentary lifestyle, lack of exercise, lack of physical activities. These are also contribute to the development of cancers. Then smoking, alcohol, these are some common carcinogenic factors. Then some women, they have a positive family history. So preventing obesity, doing regular physical exercise, avoiding smoking, alcohol, these are few factors which are in our hands. So good lifestyle is very important for preventing such type of cancers.
So, doctor, you said that breast removal is not necessary for all of the patients. So, what is the criteria for mastectomy?
So nowadays we are trying to conserve the breast. So for most of the patients we are avoiding breast removal, total breast removal. So breast conservation surgery, as I told you, can be possible in many patients, almost 80-90% of patients, especially if the tumor size is small. Then breast conservation surgery can be done easily. But if the tumor size is very large, then sometimes we may need to do a breast removal. It is called mastectomy operation. Usually this is done in locally advanced breast cancer. For those patients also we give first chemotherapy, we downstage the size of the tumor, and even in some women, even after giving chemotherapy, the tumor size doesn't regress, it remains the same. In those patients we are not able to do breast conservation surgery, then we have to do a mastectomy.
So you said that pregnancy related cancers are rare. How rare are they?
Yes. It is very underestimated thing that pregnancy related breast cancer, people don't even imagine or think that a pregnant woman can also get a breast cancer. So what is pregnancy related breast cancer? If a breast cancer occurs in a pregnant woman, that is 9 months during pregnancy and 1 year after the pregnancy, 1 year postpartum, you can say. So that duration is called pregnancy related breast cancer. Usually what happens in pregnancy, there is a growth of breast, and so if there is any lump in the breast, it is not easy to palpate the lump for that lady also and for doctor also. So many times this lump is not properly investigated, and there is one more entity which is called inflammatory breast cancer, which is more common in pregnant and lactating women. So what happens in inflammatory breast cancer, there is a redness over the breast. The skin over the breast gets red, inflamed, and swelling or swollen. It's called orange peel appearance. Almost more than 2/3 of the skin over the breast, it gets red. And it is commonly mistaken for infection. So in pregnancy, we cannot do mammography, but sonography should be done. Then biopsy of that lump should be done, and treatment should be started as early as possible. So,
on a scale of 1 to 10, how aware do you think people are about breast cancer?
About breast cancer, we can say only 2 to 3 out of 10 people they are aware. They don't even know about the screening mammography. They don't know that after 40 years of age they should do a proper screening mammography every yearly. So screening mammography is a test to detect the breast cancer at early age. It should be done by all the women above the age of 40 years.
So can you please walk us through your journey of spreading awareness about breast cancer?
Spreading awareness, I do take lectures, I give talks to the societies, screening mammography sessions, Common people also I give talks about breast cancer awareness. I like to spread awareness in the society about breast cancer.
Can you please talk a little bit about screening mammography?
Screening mammography is the mammograph. There is a special machine. It is like an X-ray of the breast only. Like how do we do chest X-ray? It's like an X-ray of the breast, which is taken in a special machine which is called mammogram machine, and there is one lady technician which helps the patient to go to the machine, and X-ray films are taken and it is read on the nowadays 3D mammography is also available.
Okay. What are the precautions or guidelines you always give to your patients?
We keep a regular follow-up of those patients, and those patients they are called for follow-up clinical checkup twice in a year, and 6 monthly we call them for clinical checkup, and all their tests including mammography, blood tests, everything is done once in a year.
Doctor, are all the lumps cancerous?
No, all the lumps in the breast are not cancerous. In fact, most of the lumps in the breast are not cancerous. But it is very important to confirm that it is not a cancerous lump.
Okay.
There are many other types of the lumps in the breast, like infective lumps, mastitis, abscess, or fibroadenomas, which happen in younger women, highlight tumor, then cyst, milk cyst, or complicated cysts, complex cysts, galactocysts. There are many more lumps in the breast.
How can one self-examine themselves for breast cancer?
Breast self-examination is that, in fact, it should be done by all the women, and it is not like it should be done every day. Is there any skin changes over the breast, any redness, any lump over the breast, any edema or swelling over the breast? Is the nipple retracted, or is there any puckering over the skin? So these skin changes she should see. She should also see if there is any obvious lump which is seen in the breast or underarms. Usually cancer lump is very hard to touch and very irregular in shape. And third thing is that she should see for any nipple discharge.
What are the misconceptions or any stigma around breast cancer?
Breast cancer cannot be curable, cannot be, they feel that all the women, they will have a loss of hair if they are, they start treatment for breast cancer. So surgery or other treatments are not responsible for hair fall.
Ma'am, you have an experience of 10 years. So far, what are the challenges you have faced?
Challenges, usually women don't come to the to see doctor in early stages. They feel that there is a lump in the breast, but it is not harming them, like there is no pain, there is no any trouble associated with it. So why to show the doctor? They just neglect themselves and they come at a larger stage when the lump has grown too big.
What is the one advice you would like to give to the young ladies out there?
Young ladies, they should maintain their like proper weight. They should not be overweight. They should do physical activities, at least half an hour's exercise every day. Then avoid smoking, alcohol. Then adapting a good lifestyle is very important to prevent such type of cancers and other diseases. That is my advice to young ladies.
Ma'am, are there any interesting cases you would like to share with the audience?
Yes, there are many, but one case I should share with the audience. So that was a 56-year-old lady, and she was having a backache, severe backache. And when I examined her, she was having a big lump in her breast. I done all the tests, mammography, biopsy, and it was a case of a breast cancer. I asked her, why did you come so late? Then she was saying, like, madam, what to do? I have a son, his job problem is going on. I have a daughter, her marriage things are going on. So I thought once this is over, I will come. Once that is over, I will come. And then it got delayed. So one important message I want to tell to all ladies, that they should not neglect any symptom. which is happening to them, not only breast related but anything. If a woman gets any symptom, she should immediately go and show to the doctor. So women should not neglect their health related problem. That is my takeaway message from this interview.
So, ma'am, what is mammography?
Mammography is a radiological imaging test which is done for the breast. Mammography is a very important investigation for breast related symptoms, and it is done using low dose X-rays. So the X-ray radiation exposure is very minimum, 0.4 MSV using mammography. It is a radiological investigation, you can say, and mammography is usually of two types. One is called screening mammography and other is diagnostic mammography. So mammography is called screening mammography when it is done in a normal woman who doesn't have any breast related complaints. It is done for screening purpose because mammography picks up breast cancer at a very early stage. Very early signs of breast cancer can be seen on mammography. So screening mammography is very important. According to NCCN guidelines, all the women above age of 40 years, they should do their screening mammography every yearly to detect the early signs of breast cancer. Second type of mammography is a diagnostic mammography. Diagnostic mammography is when a woman is already having a breast related complaints like any lump in the breast or pain in the breast or nipple discharge. So if woman is already having some complaints, then we order mammography for diagnostic purpose to look for any disease in the breast. That is called diagnostic mammography. So these are two basic diagnostic.
So, how is mammography done?
So mammography is done by using a special machine. This is the machine for mammography, digital mammography, and patient is usually there are two plates. You can see these are two plates, and the breast is placed in between these two plates, and it is compressed. There are two views taken for screening mammography. MLO view and CC view are taken. MLO is mediolateral view, and CC view is craniocaudal view. For diagnostic mammography, they may need to take some extra views like spot magnification views. In MLO view, most of the lateral part of the breast is properly visualized, including axillary tail. In CC view, as the breast compression is more, so the image quality is better and inner aspect of the breast is usually seen. Nowadays, 3D mammography or tomosynthesis, which is very popular and available, it gives more information. In 3D mammography, uh, this machine rotates in an arc around the breast and takes multiple x-rays of the breast. And then all these pictures are put on the computer. What does it does? It makes all the pictures into a three-dimensional 3D images, and this gives more accurate information, better quality of images, clear images, and this can pick up very small lesions in the breast. So 3D mammography or tomosynthesis is very good, you can say, for mammography.
So, what is breast density on mammography?
Breast density, usually it is seen on mammography images. It is the fibroglandular tissue, like fibrous tissue, glandular tissue, which is on the background of fatty tissue. So more the breast density, the more it is difficult to interpret a mammogram. So breast densities are qualified into four grades. First is entirely fatty breast, or second is we can say scattered fibroglandular. Third one is a heterogeneously dense breast, and fourth is extremely dense breast. Extremely dense breast is not an abnormal thing, but it is more linked to the higher risk of malignancy, higher risk of cancer, and also it is it becomes little difficult in dense breast to see for the lesions. Uh, very small lesions, they are difficult to see on appreciate on dense breast. So usually such mammography is usually combined with sonography. What does sonography do is like just a routine sonography of the breast, and with the help of mammography combined with sonography, a radiologist can give more accurate diagnosis of that lesion. Some lesions like cyst, fibroadenoma, axillary lymph nodes, they are better seen on sonography, and some lesions like cancer, they are better visualized on mammography. So combination of these two, which is called sonomammography, is very important, and it gives better diagnosis, accurate diagnosis. Sonography is also used to take biopsies of the lesion. Like if a patient is detected having some lump in the breast, then sonography guided biopsies are usually done, which are more accurate and gives precise diagnosis. Also, FNACs of the axillary lymph nodes can be done using UHG guidance. Some lesions like cancer or microcalcifications, which are early signs of DCIs, early signs of cancer, they are not seen on sonography. They are better seen on mammography. So microcalcifications are better seen on mammography. For those lesions, stereotactic biopsy, that is mammography guided biopsy, can be done. So this machine is very useful for performing mammographies as well as performing biopsies procedures.
Okay. What are the abnormal findings on mammography?
There are two important abnormal findings on a mammography. First is any mass or a you can see lump or swelling. It's the mass which is seen on mammography. Mass can be benign, that is non-cancerous, or it can be cancerous. The second abnormal finding is microcalcifications. Those can be also benign or suspicious. Other findings are like architecture distortion or asymmetries or axillary lymph nodes. This can be seen on mammography. So, coming to the masses, there are many types of masses in the sonography or mammography we can come around. So, most importantly, in benign masses can be cyst. They can be cysts which are like round or oval in shape. Then they can be single or multiple. They are usually in ladies between 40 to 50 years of age. Then other masses are like fibroadenomas, which are also well defined and round or oval in shape. Can be single, can be multiple. There can be a popcorn like calcification seen in fibroadenomas. Then other benign tumors like we can say hematomas or galactosele. This can also be seen in the mammography. Basically, mass is a 3D space occupying lesion which is seen on the image. Second important thing is that malignant lesions. How do malignant lesions look on the mammography? So, mammography, the most common breast cancer is called infiltrating ductal carcinoma, which is IDC. How does it look on mammography? So, it is usually a space occupying lesion, a mass in the breast, which is irregular in shape. Its margins are very irregular or speculated, indistinct margins. It is high density lesion. It may have some satellite nodules around. There may be some associated skin changes like skin edema. There can be a retraction of nipple. These findings can be seen on the mammography. Also, many breast cancers, there can be microcalcifications are associated with the mass. Almost you can say 40% of the cancers, they are associated with microcalcification. So coming to microcalcification, it is the next important finding on the mammography. Microcalcifications can be either benign or suspicious for cancer. So benign microcalcifications are nothing to worry about them. They can be skin calcifications or vessel calcifications, or as I told you, like popcorn like calcifications for fibroadenoma. So, and other type, that is suspicious microcalcification, they should be taken very seriously, because early type of breast cancer, which is called DCIs, early stage of breast cancer, it presents as a, most of the time, 70% of the time it presents as a microcalcification, suspicious microcalcification. Microcalcifications are usually calcium deposits which are seen on the breast images. They look like a white spots on the images. And in suspicious microcalcifications, usually they are pleomorphic, or amorphous or heterogeneous or linear segmental distribution. They are very small, 0.5 millimeter, irregular in shape. They can be crystal salt like appearance. So these are called suspicious microcalcifications. In some findings, you can say architectural distortion or asymmetry of the breast. You can also see axillary lymph nodes in the mammography. So these all are the findings which are seen on the mammography.
How is a mammography interpreted?
For interpretation of mammography is the most important thing, actually, we can say, because everything is depending on that interpretation. Patient's management is totally depending on that mammography interpretation. For interpretation of mammography, there is a special grading system which is called BIRADS. BIRADS is like the long form is like breast imaging reporting and data system. It is used worldwide. So it is like a uniform system which is used worldwide for, like you can say, uniform reporting and whatever recommendations for patients. So it is divided into 0 to 6 grades. So BIRADS 1 is normal finding. It's a normal mammography. BIRADS 2 is benign finding, like some fibroadenoma or some cyst, some node, like that. BIRADS 3 is called, we can say BIRADS 3 is a little bit, uh, we should take it seriously. We advise, it is not totally cancerous, but we should follow up the patient with either 3 monthly sonography, or we can do a biopsy in such patients. BIRADS 4 is a suspicious finding, which is more suspicious for cancer, and all BIRADS 4 patients should be advised biopsy of the lesion. BIRADS 5 is highly suspicious for cancer, so biopsy is must for BIRADS 5 lesions. BIRADS 6 is already detected or diagnosed, biopsy proven mammography. So depending on these grades, we advise the recommendations for the patient. Like if a patient comes to me with BIRADS grade 1 mammography, is nothing. She is normal, perfectly normal. She can do yearly mammograph, like follow up screening mammograph yearly. She can do. If patient comes BIRAD 2, it's a benign finding and nothing to be worried. BIRADS 3, I will keep a watch on that patient. I will call her 3 monthly for doing sonographies, or I can advise her a biopsy. BIRADS 4 and 5, I will definitely go ahead with other investigations. Like most important is the biopsy and other important investigations like PET scan or MRI as and when needed. So this is the interpretation of mammography is the most important thing.
What are the advantages of mammography?
Mammography, it detects breast cancer at very early stage, like early signs of breast cancer, as I told you, microcalcifications, which is a common thing in DCIS. DCIS is ductal carcinoma in situ. It is the pre-invasive stage of breast cancer. So there are 4 grades of breast cancer, 4 stages of breast cancer. Stage 1 and 2 are called early breast cancer. Stage 3 is called locally advanced breast cancer, and stage 4 is called metastatic breast cancer. So before these stages, there is a pre-invasive stage which is called DCIS, which is seen on mammography. It can be detected on mammography. So very early signs of breast cancer are detected on mammography, and so if we take this signs seriously, perform all other investigation, and if the patient is detected to have early breast cancer, the treatment becomes little easy. She can be treated properly, and many more treatments like chemotherapy and all other things, those can be skipped in such kind of patients. So mammography is a very advantageous thing. Second important thing, that there are many clinical trials have already done. So these trials have already proved that mammography prevents the mortality of breast cancer by 30%. So that's why mammography is very important, especially all the women above age of 40 years. They should do their screening mammography every year.